So seemingly overnight, the CDC has just it's collapsed. So the previous director, Susan Monarez, was fired, and there's a little bit of drama over that because she's like, I'm not fired. What do you mean? This comes from a whole slew of drama between her and the Secretary of Health and Human Services, RFK. Now, I remember when she was first confirmed. I'm talking like this was ages ago. This is like a month ago. We covered it, and if I remember correctly, my takeaway was that I think, and I still think this, I believe that she could actually be a really effective director of the CDC. Like, this is one of the most like qualified people that Trump has actually brought into his administration. But my takeaway was also anyone who's actually getting into this administration in a Senate confirmed position is obviously going to be a yes man or a yes woman. And that is pretty much the takeaway of her. I don't think she was ever directly skeptical on vaccines. I think her answer on it was, a little bit dodgy, considering the administration she's trying to get into, but also trying to keep her credibility. But I think she could have been an effective director if she didn't have any guide rails or wasn't being micromanaged by an absolute freak in RFK Jr. and just this overall anti-science, anti-medicine administration. So I was wrong. She was not a yes woman, I guess, because she was fired for not carrying out some of RFK Jr.'s policies. She was real interesting, and something I really liked about her background was she has a PhD in microbiology and immunology, and it was like with a focus of like emerging technologies that can help prevent infectious diseases and the like. So that was a really interesting, and she was actually the first person to be confirmed as the CDC director without an actual medical degree. I kind of like this difference. I thought it was actually an interesting take, and it could have been a breath of fresh air to the CDC if this was in probably any other administration. Without further ado, though, we're going to get into this article. So she was fired, and other officials have resigned in protest. It just collapsed within a 24-hour period. Absolutely collapsed. From the New York Times, new CDC director resists ouster as other officials resign. Before we get into this, if you are new to the channel, please hit that subscribe button. It helps so much. I can't even put it into words. I cover the news every single day. I try to provide additional context, and I dispel narratives. I point out hypocrisies. I have a more pragmatic view on the world around me and politics, but obviously with a progressive bias. With that being said, I'm not here to push you into one party or the other. I'm actually here to just push you to actual common sense policy beliefs, like real common sense, not mega common sense policy beliefs that, like, hey, every American should have free healthcare. The federal minimum wage should be a wage that you can live off of if you are working full time. We should have free higher public education, and we should have complete infrastructure reform. All things completely possible, no matter what the right or even the Democrats will tell you. I don't want to call them the left because the Democrats aren't left, despite what they might tell you, because this is very basic stuff in other parts of the world, or most of the world, at least in our peer nations. So if you support that message, please hit that subscribe button. Anyways, the director of the Center for Disease Control and Prevention is refusing to leave her post despite demands from Health Secretary RFK Jr. that she quit or be fired. According to her lawyers and an administration official familiar with the events, the clash between Mr. Kennedy and Susan Monarez, who was sworn in as CDC director just 1 month ago, burst into public view on Wednesday as 4 other high-ranking CDC officials quit en masse, apparently in frustration over vaccine policy and Mr. Kennedy's leadership. Yeah, no kidding. Late Wednesday afternoon, the Department of Health and Human Services announced on X that Dr. Monarez was no longer director of the CDC. Without elaborating, the agency thanked her for her dedicated service to the American people, adding, at Secretary Kennedy has full confidence in his team at CDC Gov. who will continue to be vigilant in protecting Americans against infectious diseases at home and abroad. It's hard to believe when they say this stuff because this is the most like anti-science, anti-medicine administration that I've ever seen in my life. Like they are just complete pseudoscience and like do some push-ups, go on a mile jog every morning, and you all diseases, all colds, all viruses, anything, you will be 100% okay. Hours later, Abe David Lowell and Mark S. Zaid, high-profile lawyers, disputed the department's account, saying Dr. Monarez has neither resigned nor received notification from the White House that she had been fired, and as a person of integrity and devoted to science, she will not resign. Mr. Kennedy and his department, they said, have set their sights on weaponizing public health for political gain and putting millions of American lives at risk. I mean, yeah. They cut like food safety inspections. They cut, I don't know if this is specifically under RFK's branch of control or the EPA, but like we've cut like air testing, water testing, and obviously food testing, like, and all of the vaccine research we've canceled, all of the just general cancer research that we've axed. Like, I don't know how you can make an argument that these people are actually doing good for the health of the American people. Neither Dr. Monarez nor the department responded to requests for comments. Dr. Monarez and Mr. Kennedy were at odds over vaccine policy, according to an administration official who is familiar with the events. The official, who spoke on condition of anonymity for fear of retribution, said Mr. Kennedy summoned Dr. Monarez to his office on Monday and demanded that she resign. When she refused, Mr. Kennedy demanded that she remove the agency's top leadership by the end of the week. Dr. Monarez then called Senator Bill Cassidy, the Republican chairman of the Senate Health Committee, who in turn called Mr. Kennedy. According to the official, Mr. Kennedy, furious, summoned Dr. Monarez to a second meeting on Tuesday and accused her of being a leaker. That's funny, coming from like the leakiest administration there is like possible. Within like the first 2 months, you had the Signal group chat leaks of them double tapping a freaking apartment building in Yemen. According to the official, and told her she would be fired. The official said Dr. Monarez spoke to other senators as well. On Wednesday, a White House official told Dr. Monarez that if she did not resign by the end of the day, President Trump would terminate her. The four high-ranking agency officials who did resign are Dr. Deborah Hoory, the CDC's chief medical officer, Dr. Dmitry Dashkalakis, who ran the center that issues vaccine recommendations, Dr. Daniel Jernigan, who oversaw the center that oversees vaccine safety, and Dr. Jennifer Layden, who led the Office of Public Health Data. And oh yeah, like I remember in the beginning of the term, like how they, obviously pulling out of the World Health Organization and like cutting off the tap for like public like research or whatever that the CDC does, that they like provide the doctors and medical professionals around the country. Did that ever get resumed, by the way? I haven't heard anything of that recently. Some cited an increasingly tense environment within the administration that had become intolerable. I am not able to serve in this role any longer because of the ongoing weaponization of public health, Dr. Dasikalakis wrote in an email to colleagues, adding they continue to shine despite this dark cloud over the agency and our profession. Dr. Jernigan was deeply involved in the agency's response to anthrax, swine flu, and COVID. So losing a very, at least on paper, a very experienced person within the CDC, Dr. Daskalakis helped the nation cope with an Mpox outbreak. Dr. Layden established a COVID strategic science unit, and Dr. Oury built the agency's opioid response program. Former CDC leaders said the departures would harm the agency and the nation. Yeah, no kidding. That's a lot of experience you have just walking out the door. And, it's always a double-edged sword because you think like, yeah, on one hand, it's like, yeah, it's great that this administration is falling apart. But at the same time, it's like now you're having like the qualified, and this applies to like a lot of agencies. We've seen people resign. Now we have like the actual qualified people leaving, and they're just going to be replaced with even more unqualified people and just more loyalist sycophants. So it's like, I don't know. Like, is this really good? Dr. Mandy Cohen, who ran the agency during the second half of the Biden administration, called the officials exceptional leaders who have served many decades in many administrations and warned that the weakening of the CDC leaves us less safe and more vulnerable as a country. And you pair this with all the like US aid cuts as well, because a lot of like US aid about like providing vaccines abroad, medicine abroad, and trying to fight infectious disease abroad wasn't necessarily out of the kindness of our hearts. It was actually kind of within our best interest, because when you control outbreaks abroad, they're less likely to make it to your home turf. Now we have a point where we're weakening our CDC. We've cut US aid. Like, we are just asking for another pandemic. Like, we are just on our knees begging. These individuals are physician, scientist, public health superstars, she said. I think we should all be scared about the nation's health security. The resignations, which coincided with a decision by the Food and Drug Administration to put new restrictions on updated COVID vaccines for the fall-winter season, occurred at a difficult time for the nation's public health agency. Earlier this month, a gunman angry about COVID vaccines opened fire on the CDC headquarters in Atlanta, killing a policeman, shattering bullet-resistant windows, and traumatizing employees. After the attack, Dr. Ali and Dr. Daskalakis both pushed for Dr. Monarez to reassure CDC employees that the matter would be given the attention it deserved. We're mad that this happened, Dr. Hourly said in a large group call the day after the shooting. Dr. Daskalakis, I love that name, by the way, whose office was among those hit by bullets, told Dr. Monarez that employees wanted to see a plan for their safety and an acknowledgement that the attack was not just a shooting that just happened across the street with some stray bullets. It seemed to many employees on the call that Dr. Monarez had not spoken to Mr. Kennedy directly after the attack. Mr. Kennedy did not address the shooting until the day afterward, when he posted condolences on his official X accounts. Mr. Trump has still not spoken about the assault. CDC employees issued an open letter pleading with Mr. Kennedy, who has repeatedly cast doubt on COVID shots and other vaccines, to stop spreading inaccurate information. Dr. Monarez, while not pointing a finger at the health secretary, echoed their concerns about misinformation in a note to employees. And yeah, there's a lot here, a lot of background, but that's the main part I wanted to cover here was she's gone. She is fired. Like, I assume that, if she tries to stay in there, they're going to bring her out by force. Just a spectacular collapse of one of our, like, one of the more kind of thankless government institutions, one of the ones that are just kind of in the background that you don't really think about, that are actually doing insanely important work. Like preventing disease outbreaks and pandemics and preparing and all the like. It's one of those agencies that it's one of the invisible government agencies that you don't really think of, that just collapsed, that will have long-term consequences for years to come. Anyways, that's all I have for this one. Let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below, and if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.